Okay, well, we've just got a few more people joining, but we'll make a quick start. So first of all, to say hello and a huge welcome to you all. My name's Simon. I'm the Chief Executive at the Society of Sports Therapists. And just a big thank you for joining us. I've mentioned to some, but not all of you will have heard, but feel free to pop into the chat function who you are, what you are, and even where you are. It's quite nice to get a feel for how everybody is around the country. Before we start, please just make sure that you are muted. We do have the opportunity for Q&A at the end of the session, but if at any point in time you've got a question in your mind, feel free to either pop that into the chat or into the Q&A, and we will make sure to address those questions once the presentation has finished. We'll also be recording the webinar, and we'll make it available for those members who couldn't join tonight and for any members, and we'll put that on our website within the next week or so. So do keep an eye out for that. After some introductions, which we'll get onto shortly, we'll hear from the Power Up to Play team about their journey so far, the why, the how, and how you can get involved as well. As I've said, we'll then have an open Q&A session. So you've got an opportunity to ask questions, and feel free, as I've said, to put those in the Q&A and chat function, and we'll get those picked up. Other than that, I don't think there's any other ground rules as such. We will finish at no later than 6 o'clock, but of course, you know, we can finish earlier if questions dry up and there's nothing else to sort of cover over. So before I introduce the panel, I just felt that as the CEO at the SST, I wanted to share how delighted we were with the official SST endorsement of Power Up to Play that we gave a little while ago now. They've got a fantastic shared purpose and aligned values with the society. So it was a great opportunity for us to lend our support to their aims and provide an opportunity for you, our membership community, to engage. And here you are this evening, which is fabulous. So I'll start by saying a huge thank you to the team at Power Up to Play and Kate in particular for partnering with the SST and for taking some time this evening to share their journey with you. So let's go over to introductions. Kate, perhaps I can start with you.
Yeah, sure. Hi, good evening or good early evening, everyone. I'm Kate. I'm a sports and exercise medicine specialist. I've been a doctor for 30 years and had an interest in sports medicine for about 25 of those. And my background and interest in injury prevention started when I was working in the academy section of a professional football club where I worked for 6 years. So that's a little bit about me. I'll give you a little bit more context when I introduce Power Up to Play.
Thank you, Kate. And John?
Hi, I'm John. I am the Programme Lead for Physio at Oxford Brookes University. I'm also trustee of the charity Power Up to Play. I suppose that my interests have stemmed from seeing lots of people after it's sort of too late, as it were, seeing lots of people post-surgery, lots of work with ACL rehab patients, and always interested in prevention, looking at ways we can do things differently, and that led me to get involved with Power Up to Play.
Thank you, John. Welcome. And Will?
Oh, thanks. I'm Will. I'm a knee surgeon based in Oxford, and really see a lot of people who have sports injuries, and was slightly frustrated seeing the differences between how we treat things and how we prepare athletes for sport in the UK compared to a fellowship I did in Australia about 15 years ago, where they seem to be a bit more ahead of the game.
Thank you, Will. Just a few quick things that have popped up before I pass over to you, Kate. First of all, we are recording this webinar, so it will be available for members about a week or so after this evening, so you can watch that back now if you're not able to stay for the full session. And I saw that somebody had mentioned that the chat function was disabled. I've turned that on now, so hopefully everybody has the functionality, and I'll keep an eye on that. If there's any other sort of housekeeping issues, feel free to pop that in the chat and I'll address that as we go. So thank you. I will now, Kate, pass over to you.
Fantastic. Well, let me share my slides. So the first thing to say is, can everyone see those okay?
Yep.
So just as to give some context of what Power Up to Play is about and where it started, we set up as a charity in 2019, so just over 5 years ago now, just before the pandemic. And it started in Oxfordshire. And it was a group of physiotherapists, sports doctors, and orthopedic surgeons who were all just concerned that there was injury prevention going on at elite level. But when it got down to grassroots level, there didn't seem to be so much, well, there wasn't support. There's no money at that level to do that type of support. But actually, because the intervention, which we're going to talk to you about, that the exercises are so straightforward to do as a warm-up, we couldn't really see why we shouldn't try and get that message out there. And that was the birth of the charity. And we started off as a charity called SKIP, Sporting Knee Injury Prevention Programme. But when we had a lay trustee join us, he told us that was very 20th century and no one used acronyms anymore. And that's where we changed our name to Power Up to Play. And that has been our incarnation over the last 3 years or so. So I'll come back to tell you a little bit more about that. But before I do that, I just want to give you an idea of what we're covering in the next 30 minutes. So I'm going to talk to you about, who we are and what Power Up to Play is about. Will's going to go on and explain the importance of the ACL and why injuries, trying to prevent those injuries is key. Then it'll come back to me just to give you a little bit about the evidence of the intervention that we suggest, the injury prevention warm-up. And then John's going to explain what that injury prevention looks like in more detail. And then he'll move on to just explain how you as sports therapists can help us to spread the word and to make a difference in grassroots sport around the UK. And then, as Simon said, we'll finish up with a Q&A session at the end, where we're very happy to answer any queries you have. So who we are, as I touched on, we started off as a multidisciplinary team of trustees, and that was really purposeful because we felt that this didn't really lie in one particular area. It should be cross-disciplinary. It should be something that any medical professional is interested in and wants to support. And certainly injury prevention is a bit of a buzzword in the NHS at the moment from the point of view of prevention is a really key part of their outlook and what they want to achieve in the next 10 years in the NHS 10-year plan. So us trying to prevent injury fits into that very nicely. As I say, we have 10 trustees and 9 are medical. And then we were joined by Paul Miller, who is a football coach, but also in business. So he's been a really valuable trustee who's just giving us a different insight into what we're doing. The charity aim is to reduce ACL injuries in grassroots youth sport through the use of injury prevention warm-ups. So why youth? Well, why youth? Because that's, Will's going to come on to this, but there are more ACL injuries happening in that age group. But it's also where if you can make an impact on their movement patterning as they're teenagers, they then take that through to adulthood as well. So that's why we concentrate on the youth. Why grassroots? Well, I think this is a really good slide to demonstrate why grassroots sport. Because in the UK, this is actually England FA data. But so in England, there are over 5,500 professional footballers, but there are nearly 12 million amateur footballers. And I'm picking football because it's the national sport, but I'm sure this is reflected in netball, hockey, basketball, any of the popular UK sports, and rugby. So we started in 2019. We had this idea that actually, if we could get the message out to grassroots sport, that by doing a simple injury prevention warm-up, they could make a difference to ACL injury rates in their youth players. We then started in Oxfordshire as a pilot, but with the aim to always make it national. And that's always been part of our remit and the charity's aim. So how else have we achieved our aim? Well, we have an educational website, which some of you may have already looked at, www.poweruptoplay.org, and I'll put that link at the end. And that has not only a detailed video of the warm-up, that helps prevent ACL injuries, but it also gives other advice. It helps signpost the people who want to delve into their own individual sport a bit more. For example, football has its own warm-up and so on. So we signpost to other warm-ups that they can look at as well. And it also gives people the opportunity to contact us if they would like to get some face-to-face training. And face-to-face training, we feel, is key. We teach coaches, and the reason we teach the coaches is that they have a big influence on their players, on their youth players. You know, if the coach isn't engaged, it doesn't matter how keen a teenager is to do a warm-up. If the coach wants them to go straight into a game, that's what they'll do. So we teach the coaches. We invite them to come along to a training session, which lasts about an hour, and we get them to actually physically go through the warm-up. So that's a really main part of the charity's work. And down in the right-hand corner of the screen, you can see this map of the UK and our ambassadors. And those are people who are volunteering for Power Up to Play and delivering those face-to-face training sessions at the moment. We have scaled up. So through our ambassadors, we've managed to scale up, but we still have a lot of gaps around the UK where coaches aren't getting that type of support. What else does Power Up to Play do? We're collaborative as possible. We really want this to be something that we believe it's in everyone's interest. We believe that there isn't any particular society that has more ownership over this than anyone else. It should be something that everyone should feel equally involved in. And to that end, we've really sought to collaborate with all the major medical and sports medical societies and orthopaedic societies that exist in the UK. We've also tried to collaborate internationally to learn from what other countries are doing. So we went over to Norway to look at their national injury prevention program, Skadefree, which means injury-free. And we went along and we were asking them, what can we do? Give us advice. What was difficult? What was challenging? Have you got any solutions for that? And really trying to get practical advice from them about how to set up a really effective national injury prevention program. Power Up to Play isn't a research body, but we very much support research and we follow evidence-based. We are evidence-based in our approach. So we've just had a successful co-bid with King's College London to have a PhD student. We are the charity applicant for that. So we're not actually, so it's a King's College PhD student, and they will be looking at some of the challenges to getting coaches to implement this, getting coaches engaged. Why do they sometimes come to learn, but then not actually go on and do it? So we also involved in various strategy groups around the UK who are looking at how injury prevention in the UK can be improved. Okay. And then the last thing that we do in Power Up to Play, we raise the profile through the media and we fundraise because we're a charity. So we don't ask any of the coaches for money. We don't charge anyone to do it, but we do say to clubs that if they feel like they've had useful training session and they'd like to donate something, that's always very welcome. And this is just to say how important the Power Up to Play ambassadors are to us. And it's one of the reasons we wanted to speak to you, and we'll come back to that at the end. But we have strength and conditioning coaches, we have sports physiotherapy, we have physiotherapists, we have orthopedic surgeons going out and doing these training sessions. We have various specialities, but at the moment we don't have lots of sports therapists, and we hope we can change that today. What I would love to see is stars all over that map so that we are really getting into every area of the UK. So I'm just going to hand over to Will now so he can explain more about the problem.
Thanks, Kate. So I'm just going to go and talk a little bit about what the problem is and why we're specifically focused on that. So without wanting to teach you to suck eggs, the ACL is one of the main ligaments in the knee that sits right in the middle of your knee. It's about the size of your little finger, or a sort of pencil in diameter. and it holds the shin bone and the femur together in a particular way. For low-level day-to-day life, most people don't need an ACL, and you can get back to office work and walking around without an ACL. The ACL is particularly important when you're landing from jumps and trying to suddenly change direction, and it controls how the thigh bone, the femur, twists on the tibia. And you see it here sitting right in the middle of the knee, and classically people injure it when they're sidestepping, landing from a jump and twisting. And commonly you hear the patient will describe hearing a snap or a pop or a bang as their ACL goes, and they'll feel their knee slip out of place. Normally extremely painful, and often very, very quickly they end up having a big swollen leg or swollen knee where the ends of the ligament bleeds and you get a load of blood forming inside the joint. Can I have the next slide, Kate? Why do we need to prevent ACL injuries? Is it important? How does it affect us as a nation, as an individuals? So an ACL injury is a massive deal. And it's a massive deal, particularly in teenagers and young kids. And that's because when it happens, it's painful. Almost always it involves a trip into hospital, often being picked up on a muddy field by an ambulance and driven in. And there's a whole load of anxiety around the time of injury about what's going on and with the treatment option. But it also has some sort of short and medium term effects and then long term effects. Almost all ACL injuries in teenagers require some sort of surgical intervention. That costs money for us as a society, but it also has a cost to the patient having that done. ACL surgery is complicated, it's painful, and there's a period of recovery afterwards. Patients almost universally will end up having fairly extensive physiotherapy and treatment afterwards to regain fitness and strength. And for the majority of young athletes, it's a year away from sport. And for these kids, often these are sporty kids at school. This is how they define themselves, their friendship groups. And this has not only a physical impact on them when they're away from sport, but there's very good evidence that this has a mental impact on them, but also has some social implications in terms of being out of their friendship group, and associated mental health problems with that. We also know that treating kids and adolescents is more complicated to do surgically. These are still growing people, and they have growth plates around their knee that complicates how we fix them and the surgery. And so trying to avoid these ACL injuries, particularly in teenagers and adolescents, is really important because the treatment of it is more complicated. We also know that for these children, because they're still growing, actually the ACL reconstructions we do aren't as durable as they are in adult populations. And so there's a much higher re-injury rate or re-rupture rate with teenagers. So avoiding them in the first place clearly has some advantages. We also have very good evidence that if you have an ACL injury, it's not just a short-term injury that you can recover fully from. The majority of patients with ACL injuries will have some longer-term consequences with it, with a much higher risk of developing arthritis in the longer term. And so clearly that has longer term implications both to them physically in terms of maintaining fitness, their general health, but also risks of requiring further medical interventions and costs. Are ACL injuries common? They're not hugely common like getting the flu or colds, but they're common enough. And most people, if you're coaching teams or you're involved in sport, most people will recognize people within their squad or team who've had an ACL injury or have a direct experience with it themselves or within their family. The worrying thing is ACL injury rates are going up year on year, and that's particularly apparent in teenage age group. So we first got really interested in this in about 2016 when we did a study in Oxford looking at the ACL reconstructions that were being performed in children. And the reason to set up the study was to make sure that children having ACL reconstructions weren't getting lots of complications for them in relation to how they grow. Now, thankfully, we didn't find massive issues with complications, but what we did find was this striking increase in the number of ACL reconstructions that are being performed in teenagers. So if you look at the blue line, that's ACL, the number of ACL reconstructions performed each year in the 15 to 19-year-old age group. And we see this enormous extrapolation of the number of surgeries being performed. It's growing in younger children, but once you get under 10, they're very low rates of ACL injury. So this seems to be something that happens from about the age of 10 or 11 with this increasing instance that we're seeing. If we look at around the world, it's not just happening in the UK. Almost any country where there's data that you can look at knee injuries and ACL injuries, particularly, we see this rise in the number of ACL injuries. It's growing in both males and females. The biggest rise is in females, and that may be related to a bigger participation of teenage girls in team sport, which we should be celebrating. But there are also some specific factors with girls that put them more at risk of ACL injuries. You may have seen that with the Women's Football World Cup last year, there was quite a lot of media interest in ACL injuries amongst female footballers, and we know quite a lot about how these happen. So, as I said, most of the injuries are through a non-contact mechanism, and there are intrinsic factors that can make you more likely to have an ACL injury, as well as extrinsic factors. So if we think about anatomical factors, we know that girls are slightly more susceptible to ACL injuries, and that tends to be because of the way their skeletons are formed. They have slightly wider hips, and that means their knees tend to be slightly more valgus or knock-kneed in orientation, and that puts more pressure and strain on the ACL. They also have a slightly narrower notch of their knee, and that means the ACL can get pinched if its knee slightly twists, which can then lead to failure. Girls have menstrual cycles, and there is evidence that as their hormones changes, they can be slightly more prone to injuries. The evidence supporting ACL injuries directly is not as strong, but certainly there are factors around menstrual cycle and hormone changes that may make them more prone to these sorts of injuries. If we look at some of the extrinsic factors, definitely the type of sports that you play has an impact. So ACL injuries are much commoner in sports where you're landing from jumps and twisting. So football, rugby, netball, hockey, basketball are the big ones in the UK. There's been a load of interest about playing surfaces and footwear. The evidence supporting these as risk factors is really very limited. There is some evidence that there is societal factors in terms of gender bias that again put girls slightly at more risk of ACL injuries. That may be related to strength and conditioning not being encouraged when they're younger to do as much physical activity, and so losing some movement patterns. I've lost a screen, Kate. I don't know if that's there. Yeah. The biggest factor that increases the risk is probably an intrinsic factor related to strength and conditioning. There is overwhelming evidence that with structured programs that look at improving strength, conditioning, proprioception, we can have a huge impact on reducing ACL injuries. There's been evidence now for 15, 20 years on some of the programs that we're going to be talking about to show that if these programs are adopted by teams, particularly teenagers, particularly teenage girls, they do the programs twice a week for 15 minutes each time, you can reduce the chances of them having an ACL injury by over 50%. And so really, for me, this is the area we need to focus on. If we're thinking about the rise in ACL injuries, spending a lot of time looking at footwear and playing surfaces when there's no evidence, we're really missing something that we have very strong evidence can influence ACL rates. And that's where we need to be focusing our attention, which is why we're here tonight talking to you about this. I think I'm handing over to Kate now.
Yeah, thank you, Will. So the next slides is just covering the evidence. Now, there's a huge amount of evidence here, and some of you will be super interested in this area. So just contact me. We'll give you the email at the end if you want to delve into this more. But I'm going to give you an overview. So Will's already intimated that how effective a really simple evidence-based injury prevention warm-up can be. Now, this is not new. As you can see from this slide, all I'm going to tell you is that this very first paper, 2003, we're talking about over 20 years ago. Okay, so this is not new evidence, is the first thing to say. The next is that if you're really interested in knowing more about the evidence, I'll direct you towards this systematic review by Huang et al. From 2020. And this looked at only high-level, high Pedro scored RCTs. And even when they got rid of some of the less high quality material out there, they still found that injury prevention programs or warm-ups had a significant protective effect. This is a slide that just gives you an overview of what other information we get from that Huang systematic review. So what do we know about injury prevention programs? Well, what we know is they work in adolescents and young adults, because Huang found that the highest quality evidence was between 13 years of age and 26 years of age, okay? We don't actually know whether these have an effect in older adults at the moment. We just don't have the evidence to support that. For younger children, like less than 12, what we know is that doing an injury prevention program can protect them from lots of other lower limb injuries, but we don't know about ACLs because in the study that was done, there were no ACL injuries in the study period, but they had a clear beneficial effect on other lower limb injuries. Gender-wise, there's evidence for both male and female having a protective effect, but the vast majority of participants in the studies are female. From a sport point of view, we have research papers in football, rugby, and basketball that show an effect. We don't have any studies in netball and hockey, but I personally feel we can be pragmatically extrapolate. We can say, well, look, they share enough of the similar mechanisms, jumping, landing, changing direction, particularly in netball, that you can extrapolate and assume some benefit from doing an IPP in those type of popular UK sports. Another interesting thing that Huang pulled out is that not only does doing an injury prevention, ACL injury prevention program reduce ACL injuries, but it also reduces other lower limb injuries, ankles, hamstrings, etc. So it has other benefits. I won't go too much into this slide other than to say that this paper and another number of other papers shows that doing an IPP, when you apply it to the whole population and don't try and do any screening, where you're trying to look for certain biomechanical abnormalities and say only you do an exercise and you don't bother, that's too expensive because of the cost of that type of screening. But if you do a blanket approach and ask all young people to do the warm-up, then it's a very cost-effective program to do. And then this slide is just explaining that people have tried to work out within those programs, because the program we do is just one of many, what's effective, what part of that program is making a difference. And this paper by Sugimoto tells us that frequency is important. So ideally 2 or more times a week, okay? Giving verbal feedback, so soft knees on landing, make sure you've got good knee positioning. The right age group, so it's most effective when applied to those teenage age groups. The warm-up has different components. It's not just a balance warm-up, or it's not just a running drill. It has to have some plyometric work. It needs some strengthening work. It needs some control work, okay? and that actually the duration, the longer it is, the more effective it is. Now, we have to be pragmatic there because we're working in amateur sport, grassroots sport, where the coaches only have an hour maybe with their players. So we have to say, we actually chose the evidence-based program that was the shortest so that they can engage with it. Because if we give them a 25-minute warm-up program, they're just not going to do it. Okay, so we got some good information from the evidence out there. And this is just to say that compliance is key, i.e. it seems really obvious, but if the players don't actually do the warm-up, they're not going to get the benefit. And to add to that, the more often they do the warm-up, the more benefit they get. Okay. And then this very last slide is just a really nice paper that looked at the positive spin, because of course coaches don't particularly want to be thinking the whole time about injury. They want to think about performance and success. And this looked at the win-loss over a season for a large number of clubs that were doing an injury prevention warm-up. And they found that if they were doing moderate, which was 1 or more times a week, or high, which was 2 or more times a week, that they had a better win-loss ratio than the clubs that were either doing nothing or their normal warm-up. So we think that's a lovely message for our coaches. So that's a whistle-stop tour through the evidence. And if you're interested, please email me. I can send you lots of papers to look at. But I'm going to hand over to John now just to talk through the practicalities of what the warm-up looks like.
Great, thanks, Kate. So we have on the slide here everything that's included in the warm-up. I'm going to actually play the video of the warm-up, and this video you can get by the QR code that's on this slide. You can get it by going to the YouTube link, or you can get it by going to our website, and you can find a link to the video there. But if I share a video now, we will have a look at that together. It's a 4-minute sort of long video looking at the program.
This is a 12-minute warm-up program that has been shown to reduce injury rates during sporting sessions. It should be performed regularly before every training session or match. The program works by strengthening muscles and promoting strong body positions when changing direction or landing from jumps. It is important during the program that athletes focus on having good form, rather than focusing on speed or effort. The key is to maintain hip and knee stability, landing with soft control, and keeping the knee directly over the foot. Here is a good example of a strong body position. Notice the body is well aligned with the knee directly over the foot. Try to avoid letting the knee deviate inwards or extend out beyond the foot position, as this position has been associated with a high risk of serious knee injuries. The program starts with a couple of short jogging exercises to raise heart rates. First, 30 seconds of line-to-line jogging, followed up by 30 seconds of shuttle running. And finally, 30 seconds of backwards running. The warm-up then moves to a strengthening component. This starts with 1 minute of walking lunges. Notice how the athletes are focusing on the quality of their form rather than their speed. 1 minute of Russian hamstring exercises, otherwise known as Nordics. A partner is required for this, and you can take turns, switching after 30 seconds. Concentrate on keeping the core strong and the body straight. 1 minute of single toe raises, 30 seconds on each leg. Try to balance as best you can, but if you lose control, just continue the drill. We now move into the plyometric or jumping section. This helps work on explosive power to help with acceleration, but also control deceleration. Use a line on the pitch in this section to help with the exercises. First, 30 seconds of lateral jumps. Jump from side to side over a line, landing on the balls of your feet with a bent knee. This can be progressed by jumping to the outer leg on each side of the line. 30 seconds of forward and backward jumps. These drills are basic, but performing them correctly with soft landing and good body position is critical. 30 seconds of single leg hops, forward and backward over a line. 30 seconds of vertical jumps. Jump vertically upwards, using your arms for momentum, and remember the proper landing technique. 30 seconds of scissor jumps. Make sure the front leg doesn't deviate inwards at the knee. This next section looks at agility exercises. Again, focus on quality of form rather than speed. First, a forward run with 3-step deceleration for 1 minute. Pick up speed and then at a given point, abruptly decelerate to a stop in 3 steps. Diagonal runs for 1 minute. As you switch direction and push off, ensure you focus on control with a stable body position, not letting the knee drop inwards. Lastly, 1 minute of bounding run. The athletes are now warmed up and ready to participate in training. Remember, at the end of training and matches, it is important to incorporate some stretching. So, 30 seconds of calf stretching, each leg. 30 seconds figure 4 hamstring stretch, each leg. Inner thigh stretch, 30 seconds on each leg. 30 seconds of thigh stretching on each leg. And finally, a hip flexor stretch.
Great. So that's the program, and as you will note, in 4 minutes, it made reference many times to good form, good knee position, alignment. It is not about looking at maximum speed or effort. It is going through those components and making people think about the quality of their movement. And that is why you've heard feedback mentioned earlier. That is an important aspect to the training that we give, giving feedback to coaches in order that they can give feedback to people that are then participating in the warm-up. Now, as I said, you can access that via our website, and you'll see that we use the PEP. That's the particular program that we use, the Prevent Injury Enhance Performance. If Kate moves on to the next slide, I think you'll see there's other approaches that are used in other sports. So, for example, the FIFA 11 Plus is used in football. There's specific programs in netball, the Activate program in rugby, and we're very happy that those other programs are out there and they exist and that sports are using them. The PEP, I think, is helpful for us in that it is straightforward and simple, and also the time that it takes. The video said at the start there, it's 12 minutes long. We are trying to get people using this in grassroots, and coaches don't have a lot of time free, and so just the time and the simplicity of it is I guess why we've picked it. Next slide. Yes, the key messages for the players. That's not a race. Like that, maybe that looked quite gentle to you, that warm up when you're watching the video, but it's about being steady and having control, thinking about landing well, thinking about quality of movement, soft knees on landing from jumps, and knee over toes when lunging. So avoiding kind of like that knee dropping in or out. And these are sorts of things that we would see and we would pick people up on and kind of correct that. And so that feedback is super important and key messaging for players. Next slide. So what can you do? Well, a number of things really. Ambassadors have already been mentioned at the earlier on in their presentation. You could apply to become a Power Up to Play ambassador. That's for people that are sort of year 2 students onwards, and you can do that by going to our website, and you can have a look there. There's contact details. I'm sure they're at the end of this slide PowerPoint as well, where you will have access to the recording. So you can get in touch with us there. You can attend an online train the trainer session. We have mentioned that we run training. It's one of the main things that we do, and you could then run a local coach training session at your club where we could come along, help out, or we could send an ambassador to help out running a session training coaches at your location. You could receive a Power Up to Play trainer certificate for your continuing education and your development. So I think there's lots of things you could do, and I'd say when you get a chance, do go look at the website. You can read much more about stuff there, but there's lots of links and contact details on there to get hold of us. So that's the program. That's what we do, and I think the final slide might be the last one. There we go. So there's some more contact details there, including QR code where you can email for more details. So I will finish that. I think we're going to move to questions.
Thank you, John, Will, Kate. Really great to hear. Let's leave that slide up, I think, so that people have a chance to make a note and what have you. I'm sort of going to pass over to John to sort of facilitate any questions that may come up. Before I do that, just a few things. Because there were so many of you, unfortunately, we didn't allow cameras. But if any of you do put up a virtual hand, then I think I can allow you to speak. You'll just need to unmute and then you can ask your question. We've still got the Q&A function as well, so you can use that if you wish to do so. But when I noticed there was a comment which I think Ophelia had made, which actually just came to the host and panelists rather than everybody. I didn't know if you wanted to just pick up on that one.
Yeah, so she made a comment about the mental impact of these sorts of injuries, and I think she points out that that's massively overlooked. So often when we're hearing about ACL injuries in the media, it's a professional athlete who's 25, 26, and they've often been exposed to other injuries or in an environment when there are players with other injuries. I think it's a very, very different beast when it's a 13 or 14-year-old who has this injury. It is probably the worst consultation that I have each week is with a 13-year-old, often with both parents. And often all, or at least some of the people in the room are in tears because of the implications of this injury. And that's really just addressing the short-term treatment of it. It hasn't gone into then the potential longer-term consequences of risks of re-injury and arthritis in the longer term. And so I think we do underplay how big a deal this is for 14-year-olds. Kate has had some information. You've had some information, Kate, about some of the mental health impacts of this sort of injury.
Do you mean research or
Yeah, or dealing with football players?
Oh yeah, no. So when I was working in the academy, of course, the academy isn't wasn't professional. They were just very, very wonderful, keen young people that gave up a lot of time for something they loved. And I mean, it was really noticeable. We had a horrible run of ACL injuries, and you just see how it impacted them. They lost their place on the team, which sounds very, maybe that's a bit superficial, but it's not because they give so much of their time. Their mates are at the pub on a Friday night and they're staying at home ready, so they're up ready early for training the next day or in the gym. Whatever. They're really dedicated young people, and it's devastating. And they lose their sort of sporty people to a certain extent. Become a little bit defined by their team, particularly they play team sports. That's their social group. They spend a lot of time together, and to lose that is very hard. And even in a professional football club, those who were injured, it was very hard to keep them engaged with the rest of their team. I mean, I know that's the ideal, but actually it's just very difficult to do and impossible at amateur level. So kids get very isolated, and 12 months is the very minimum on the NHS, because if they're going to be sporty kids, they're going to probably need an operation. And that means they're waiting for one on the NHS, which means you're probably looking at 2 years. And that's a long time of not being able to do any sport.
Yeah. There's a really interesting question from Graham Vaughan has asked, do we know why this increase is happening around the world? John, I mean, I know we've debated this lots of times and talked about it. What's your thoughts on why are we seeing this rise in adolescent ACL injuries?
I think when you see a rise of that level, it's never going to be down to one thing. This is obviously a multifactorial thing. There's obviously lots of things feeding into seeing an increase in injury. I found it interesting because in Power Up to Play, I suppose we're focusing mainly on lower limb, but there's research out there of people that have seen this increase in injury in upper limb as well, in different kinds of sports. So there could be many, many reasons, and it could be like Will mentioned it earlier about like the increase in girls participating in sport, which is brilliant. Like I have three daughters. I'm all about them taking part. It could be that we haven't really thought about what things need to look like for them taking part. Like there are loads of people out there looking at things that Will's mentioned that probably aren't to have like footwear and pitch type and but you know are people as physically literate, if that's a phrase that we could use, like do we have as much robust training in things like PE, or are we sat lots and then suddenly going out at the weekend and playing? There could be loads and loads of reasons why we see an increase, and I think it's impossible to say there's one specific reason why. um, there is lots of people looking into it that I'm aware of. There's lots of people doing research into the area, and I think we'll see more and more the factors that are important. But yeah, it's a good question, Graham, and I just have to say I don't think there's one thing.
Yeah. Just another follow-up from that, John. Someone's asking a question about people who've already had an ACL injury or ACL reconstructions. Is this sort of program appropriate for them?
It is, yeah. There's less evidence out there about preventing a secondary injury or secondary prevention, but there is some. I think Kate may be more au fait with that, but there is some evidence out there to say it can help in secondary prevention. And why, if you were doing it as part of a team, this is how I see this happening. It happens as part of a team training session. Why would you exclude that person that's had the previous ACL anyway? If they're back and competing, I think they'd be taking part in the warm up. I don't see any problem with that, and there is less evidence than in primary prevention, but there is some out there. Kate, are you aware of any specific research in that area? No.
No, I haven't. I haven't seen for injury prevention warm-ups. I haven't seen any studies in not specifically for comparing groups that are primary versus secondary.
I know I've got one in the reference manager somewhere, but like I'm not even going to attempt to dig that out now. But yeah, there is limited. I'd say there's limited evidence, but theoretically, it still makes a lot of sense for me that we should be doing it with those people.
I think a lot of surgeons around the world now are using these sorts of programs as part of their rehab programs to get people back into play. So for the 3 months for returning to play, you want to be getting athletes doing these sorts of IPP programs because it's all about strengthening, conditioning, movement patterns that will protect them, putting themselves in vulnerable positions. Kate, there's a question here about schools. Are we helping with schools, or are we mainly focusing on local clubs? And also, what's the age group that you should be starting these sorts of programs off at?
Yeah. So when we set up the charity, we discussed this a lot. I went along to the PE teachers conference and told them about what we were trying to do, and they loved it, but they said it wasn't practical in the state system at the very least. At least that to try and do even a 15-minute warm up in a 40-minute gym session, it just wasn't going to happen because they spent most of their time trying to chivvy the kids out of the changing room to actually get onto the pitch to do anything. But lots of the PE teachers who also do after school clubs said, we will do this in our after school club where we have a full hour with our players. So that's where we got to with schools. So we had a slightly mixed message. So what we did is said we would aim at clubs, and within that we tend to pick up quite a lot of the PE teachers who do after school clubs as well. But we didn't purposefully or specifically focus or target schools because of that feedback. What was the other question, Will?
And age groups. When should we start it?
So at the Huang paper very clearly shows us that the evidence for the injury prevention programs that we're using starts at 12 years 9 months, so over 12. What we tend to do is we don't ever turn away any coaches because we believe the sooner that younger kids actually start to strengthen and work on their balance and so on and get used to turning up and doing a warm-up at the beginning of their sport, then when they're actually become teenagers and are at high risk, they're hitting the ground running. It's probably not the best phrase to use, but apologies for that. So what we tend to do, if we have coaches of younger age groups, we signpost them to sort of fun-based games like toilet tag, which is a bit like stick in the mud, but instead of them having to climb under each other's legs, they have to go down into a squat like a toilet and then wait to be flushed. And the kids love this. In fact, the coaches love this. And we musical statues, or not musical, statues to a whistle, where they have to stand on one leg. So you start to get them to do a warm up, which is starting to improve their strength, improve their balance, and then they can move on to more complicated warm up as they can cope, as they're able to engage with it.
And the other end of the spectrum, Joe was asking a question of, are these warm-ups not effective for adults? Should we not be doing them for adults too?
We just don't have the evidence. In fact, there is a paper looking at this, but it didn't show any improvement. It didn't show any reduction in ACL rates. Now, that might be because there wasn't enough engagement and compliance, because compliance data for that paper wasn't collected rigorously. So it's not quite of a good enough quality as a paper to draw lots of conclusions whether the prevention program was used properly and just didn't work for older age people, or that they just didn't really engage and do it in an effective way. And so the answer is we don't know.
Yeah, I would encourage people in grassroots sports to do a warm-up program like this. So if you watch Premiership football and you look at the exercises the players are doing for the 20 minutes, 30 minutes before they come on the pitch, a lot of the exercises follow these sorts of programs and the same movement patterns. And I think it's a good strength conditioning program that people should be doing. But as Kate said, we just don't have the evidence that they have a sustained reduction in ACL rates if they do this in that older age group. There's someone, Emma was asking if this program can be used in other sports. Absolutely. So there's no reason why this wouldn't be an effective and good warm-up for cricketers. Again, the risk of ACL injuries in cricketers is much less than in, say, football or basketball because of the type of movements the players get into. Kate, another question for you here from Antonio. Talking about, so you're asking questions saying that we've mentioned that the ACL risk is higher in women. And is there any current injury prevention program specifically designed for women?
Not that I've seen. No. But if you look at the research, and I touched on that when I was summarizing the Huang paper, the very, very large majority of the participants in those studies are women.
Yeah. I mean, I would say that's what my response would be. All the programs that we've shown that they're most effective in the female age group. So this is absolutely what teenage girls should be doing. I'm just trying to look through lots of questions, so I can't keep up with all of them. A question here about if people want to be an ambassador, how do they go about doing that, and what does that look like for them? Kate, you may be in a good position to talk about that.
Well, it's email me via info@PowerUpToPlay, and then what would be really nice is just to do a little Teams meet to get to know you, and just to understand where you're at, if you're a trainee or if you're post-grad. That'd be interesting to know as well. What area you're in, and we'll be very, very, very much welcome any support you want to give. What does it look like to be the ambassador? Well, it sounds like a very grand name, and there's lots of discussion about that, but trainer seemed a bit too vague. So an ambassador is some of our ambassadors just talk in clinic to their young players and to coaches and to parents. So some of our orthopedic consultants who are ambassadors don't have the time to go and do face-to-face training or don't feel comfortable to do that. And that's what they do as an ambassador. They talk about it at meetings, and they talk about the issue in clinic. So that might be applicable to some of you who are post-grad and working. Or being an ambassador often means helping do face-to-face training sessions. And that involves, we give you all the resources, so a very short 10-minute presentation and some lanyards with a summary of that warm-up we showed you. And we get those coaches out and practicing, because I think the sooner they get out and actually do it, the more embedded it is and the more engaged they are. And that also allows them to ask questions, and we can check their knee positioning and so on. So that takes about an hour. Sometimes if there's lots of questions, an hour and 10, but it's a nice short training session, because coaches at grassroots level have daytime jobs and they're busy. And we don't want, we need it to be short and concise. So that's what a training session looks like, and that's what lots of our ambassadors do.
I got a quick question for John. If people are struggling with specific exercises on the program, things like bounding runs, or I know that we've had difficulty teaching people doing Nordic hamstrings, particularly if they're playing on tarmac courts. Are there other exercises that people can do instead? So things like ABC skips.
Yeah, I think you might have to make pragmatic decisions. I guess we would do, as a physiotherapist, I would do that a lot when using like the Nordics is a good example. Can you take something along in order to make that possible? Can you have some towels? If not, then maybe it's not going to happen. In terms of the I saw that question. I miss it. What was it about
Bounding
runs?
So bounding runs is quite challenging.
Yeah.
Sometimes at the end, particularly if people aren't used to doing these programs, after 10 minutes, quite a lot of them are a bit fatigued.
Yeah, I mean, I think the components of the intervention have been put together for a specific reason. It's good to try and cover them all. But if somebody is unable to do one of the things, I would just make the pragmatic choice, say that's fine, we can make that easier, or we can move on. And it's got to be better than doing nothing. Like a lot of the interventions that I use every day, doing something has got to be better than doing nothing. And so, yeah, I would not have a problem if somebody really couldn't do that.
I would also add to that having difficulty doing a bounding run might well be. I can't show those when I do the training sessions, because I've got a knee problem. I'm of an age. But I think most teenagers, unless they have an injury, should be able to do a bounding run, and they should be able to cope with a 10-minute warm up if they're going to do a 60-minute game of football. So I don't totally buy into that argument that it's tiring. I think that as they do it regularly, they get fitter, and that's part of the key to preventing injury, is being more athletic. So it's more about encouraging them to participate, even if I think with our teenagers, it's often because they're embarrassed because you look a bit stupid doing it. So that's more the issue we find.
Yeah, the bounding run is a good movement pattern to be able to do if you're about to go and play basketball, netball, football. It shows that you've got good strength. There's a question here. What's the best way of returning an athlete to play after ACL surgery? Really good question, and there's huge debate about how we do that. There are very, very few objective ways of saying when someone's ready to return to play. And the ways or the evidence that we've got of saying when we think someone is ready to return to full play often involves very expensive instrumented gait labs and force plates to try and check people's strength back and their movement patterns are symmetrical. So we are a long way off having a really good way of saying when someone's ready to return to play. That there is very clear evidence that people who go back to playing competitive pivoting sports sooner than 12 months after ACL injury or reconstruction have a significantly higher risk of re-injury. And that may be related to neuromuscular patterning and proprioception rather than just strength on its own. I'm trying to keep up. Is anyone else looking at the chats?
I was just checking with Simon that we're right on time. I
think we're near the end of time. So I'm going to hand back to Simon, but say thank you for everyone who's put loads of questions in. And while I'm here, before handing back to Simon, say thank you to Kate for putting this together and organising this with Simon, and thank you to John. Simon.
Thank you. Thanks, Will. And thank you so much for everybody for popping your questions in, a huge enthusiasm. What we will do is we'll endeavour to go over those questions, and those that we haven't been able to address, I'll certainly ask Kate and team if they can provide a sort of short sort of summary response, and we'll get those out to you. It's also worth saying that somebody posted quite early on about CPD certificates. We will be providing a certificate of attendance to all of you that have attended tonight, and we'll start getting those out to you later this week. So first of all, it's a shame that I can't see you all, but I would just like to say a huge thank you and a kind of round of applause. I'm going to give you the sign language round of applause to Kate, Will and John for joining us and for sharing Power Up to Play. The evidence that sort of sits behind all of this as well is really fabulous, and I know there's a lot of interest in that detail. If you are interested, of course, don't just wait for an email from us. Get in touch. I think it's the info at, is it Kate?
Yes.
Yes. So the info at, which we popped into the chat, and again, you can find Power Up to Play very easily online on their website. So do just drop them a note with your questions as well. I'm sure they'll be happy to answer those. So big thank you to our panel, and a huge thank you to all of you for joining us. We've had a fantastic positive response to this webinar, and certainly from the SST's perspective, we're committed to bringing more opportunities such as this for you to engage and connect. So just another quick reminder, if you want to get involved, find out more and volunteer, you can get in touch with Power Up to Play, info at, and they'll be delighted to hear from you. So thank you all for joining, and have a lovely evening. Thank you. Goodbye.